Yeah.
Okay, being 8:30, I'd like to call to order Public Health and Community Service. Could I get a roll call, please?
Hendricks. Krieger. Here. Van Hoff.
Present.
Sullivan.
Here.
Shorten.
Here.
Altoff. Von Bergen.
Here. All right, could I get a motion for minutes approval for May 1st?
I will.
Mr. Sullivan, seconded by Mr. Shorten. All those in favor?
Aye.
Those against? Motion carries. Public comments?
There's none signed up.
None.
Last call.
Okay.
Alex? Nothing?
All right, seeing no public comment, how about member comments? Any member comments? All right, moving right along. So we will go to the routine consent agenda. Are there any items anybody would like removed from the routine consent agenda? Okay,
I'll make a motion.
all right. Mr. Shorten motions and a second. Mr. Sullivan seconds. Make a roll call, please.
Van Hoff.
Yes.
Krieger.
Yes.
Shorten.
Yes.
Sullivan.
Yes.
Von Bergen.
Yes. All right. So next up, no old business, we're to presentations. And we have the Director of Environmental Health, Patty Nom. Thank you for joining us. As we head into the busy outdoor season, I think it's important that we take time to better understand our food inspection program, how it operates, especially with so many events and festivals taking place. With several new board members joining us, I thought it was a great opportunity, and I know you presented before the Board of Health, so I thought it was a great opportunity, for all of us to learn more about how inspections are conducted and how the department works to protect public health. So with that, welcome. Thank you for coming.
Thanks so much. So I just wanted to give you like a general overview of our program, some of the activities that we do. And then I want to speak to what the number one question we get in our program is which is, how do we promote consistency among our inspectors, right? Because that's one of the number one questions we get from our food operators. So these are our core responsibilities. So we do plan reviews for any food establishment that is going to be remodeled or new ones. We do all the reviews for any cottage food operations. Just as a reminder, those are operations where they actually prepare food out of their home, and then they can, sell that at farmers markets or directly to the consumer. We do opening, routine, follow-up, and complaint inspections. As Tracy said, we inspect and oversee all the temporary food establishments in the county. We do complaint response, illness investigation, and we do public education. And just as a reminder, all of our food inspections are done electronically, so as soon as they're completed, they're immediately available on the department's website. So these are our 2024 numbers. We had in 2024 just under 1,500 food establishments, just under 1,000 temporary food events. We conducted 6,455 inspections. We responded to 332 complaints. We reviewed 195 new or remodeled food establishments, conducted 125 cottage food reviews. We had 2,247 consultations with people who had questions about food or food protection. We did conduct 8 virtual office hour meetings with 514 participants for our food establishments. And then we had an additional 8 public education events with 1,900 participants. So our virtual office hours, which is something that we started last year, was just trying to reach out to our food operators just in another way that's convenient for them. And so we do that once a month. And these are some of the topics we did. We did some of the required documentation, particular to policies and certifications. We did a couple meetings on updates to the FDA Retail Food Code that went into effect in January of this year. We've talked about plumbing and physical facility maintenance, sanitizing procedures, cleanup procedures for illness events at food establishments, what's in a label specific to chemical labeling, and then the menu requirements, consumer advisories, because there were some specific changes from last year to this year with undercooked foods and or allergens. So as a certified local health department, we are reviewed every 3 years by the Illinois Department of Public Health. They do look at our ordinance, our inspection frequency, if we've done the follow-ups correctly, if we're citing the correct violations, what our public education looks like, and the plan reviews that we do. The regulation that we actually fall under would be the 22 FDA Retail Food Code. That's universal throughout Illinois. And then the Illinois Department of Public Health has a separate code, the 750 code. There are additional requirements in there. And then in Articles 1 and 2 of the Public Health Ordinance, that's where we do our administrative and permitting requirements, and we have a few additional requirements there. So it's a lot for our staff to know. It's also a lot for the food operators to know too. So, our consistency among inspections and inspectors, like I said, the #1 question that we get. So-and-so was in there last time, they did not mark that violation, now it's being marked. So I just wanted to go through the protocols that we have in place to, assure that our staff are well-trained and that they're looking at things as similarly as possible. So first is, how do we train our new staff? So we start with shadowing of existing staff, and our staff then is required to become familiar with and study the relevant regulations. There's quite a bit there. Then they will have escalating involvement in our partnered inspections. So we have senior staff, more experienced staff going out, and then they get more involved in those and start writing the inspections themselves. They do go through a standardization exercise inspection with our field staff supervisor, who oversees that program to be sure that they're seeing things correctly. Then they will start doing independent inspections, and we start with our lowest risk, which is Category 3, our simpler facilities, and then work up to our Category 1s, our more complicated facilities. And that takes about 5 to 6 weeks, to get someone up and running and doing independent inspections. And then we do follow-up with that, of course, so we have standardization exercises with our food program supervisor. We do those 2 to 4 times per year, and again, making sure they're seeing things correctly, citing things correctly, interacting with our food establishment operators correctly. So in addition to that, there's quite a bit of other training that our food staff has to have. The Illinois Department of Public Health works with the FDA and CDC in providing training. So by year, they have to do certain types of training in addition to what we provide. So year 1, they have to review public health principles, microbiology, communication, regulation, citations, and then at level 2, it gets up to illness, outbreak investigation, more complicated food processes, allergens, and then level 3 is really environmental assessment, which is the ultimate objective of FDA food inspections. And so they have to do a minimum of 5 hours of that continuing education annually. So people who work in our food program are continually, learning new things, reviewing the things that they already know, and are being trained really on a continuous basis. So in addition to that, we ensure that each of our staff has the correct supervisory support. So the way we have it set up now is every day our food staff gets together with the supervisor and they meet for 15 to 20 minutes. They receive their assignments, they discuss any of the issues, and they get guidance at that point in time. They also meet every other week to discuss any updates going on, share inspection concerns, and then any trends that they're seeing during the inspections. And that trending information is what we utilize actually to then develop our virtual office hours. So we're really trying to address what we're seeing out in the field, and providing that education through those virtual office hours so that we can get more operators educated. And then they have an access to our on-call staff for evening and weekend inspections. So our staff's really never out there on their own. They always have access to a supervisor for direction. We also try to work on a regional basis for consistency, so we do participate in the food subcommittee of the Northern Illinois Public Health Consortium. They do meet quarterly, and then they have routine phone and email contact, because if something's happening over in Lake County and it's really very similar here, we really try to approach it as similarly as we can so that, you know, someone isn't operating something there and getting different answers than they are here. We also participate in the monthly IDPH virtual office hours that they hold for staff, and then we can contact them at any time, or FDA staff for further guidance. I do like to speak a little bit to the FDA Retail Food Code, because when we adopted that in 2017, it really changed the nature of our inspections that we do. So prior to that, we had a 45-point checklist. We'd go through, we'd cite a violation, we'd mark what it was, and we'd go on. But the FDA Retail Food Code is really predicated on risk-based inspections, meaning that our job is to evaluate the operations that we see there taking place in that facility at that time. And so not every inspection is going to be identical, because food, facilities are continually, changing. They're not stagnant places. So we are looking at what we see. Our job is to evaluate those conditions. We try not to concentrate on floors, walls, and ceilings, because they are important for sanitation. But in terms of processes, that's not really what we find causes foodborne illness, right? So we try to review the processes they have in place. We ask lots of questions. We like to have an interaction with the persons in charge. And really, the FDA Retail Food Code is set up that the person in charge of that facility really has a lot of responsibility for what happens there. They're required to have a certain amount of knowledge, be able to answer certain questions, and they are responsible for what's happening from a food safety standpoint in the operation on a daily basis. So then what do we do when we have disagreements with staff? Because it does happen. I mean, certainly we're not perfect. We do make errors sometimes, but then sometimes it's a matter of just we have to explain something. So we do have a process in place. And the most common thing is that there will be a phone call or an email to the staff supervisor or to me, and we just pull up the records immediately. We discuss the inspection with staff, and 9 times out of 10, we can resolve that issue right then. If errors are confirmed, then we go in, we'll correct that inspection report. We're cognizant that those are online, and the operators are very cognizant they're online. So we want to make sure they're correct. And if there's an error been made, then we retrain our staff, we review with all the food program staff, and we move forward. If the operator does not get satisfaction at that level, they have the option to file a formal appeal with the public health administrator. And if they don't agree with our administrator, they can go to the Board of Health Hearing Committee, who then makes a recommendation to the Board of Health for a final decision. So there are quite a few options. It's not just in food, it's in all our program areas. But if someone does not feel that they have, been cited correctly, we do have a process so that can be resolved. So I just have to review my examples. I'm sorry. Let's see. Oh, okay. So like I said, the number one thing we get is someone did not actually cite a violation last time. So I was actually asked to go out to a facility not that long ago and look at, a very similar thing. It's a common question we get. So food staff, it gets hot in those kitchens. It really does. So they are allowed to have a covered beverage in there. You know what I mean? We don't want dehydrated food employees in there. So they are allowed to do that, provided they store those beverages in a safe place so it's not going to contaminate food or equipment. So in the case that I went out to, they had said, well, I was told I could store it right there. The next person comes in and says, I can't store it right there. So that was actually just a situation where they can store it low and below, but it also has to be stored separate from the food equipment. So it just happens to be that they can store it there, but then they had stacked food and food equipment right next to it. So really it didn't meet the separate and below. So sometimes it's something as simple as that, and we can work through it. They were happy to have the clarification, and we moved on. So that's, fairly typical. What we are trying to do is just provide a better record of those recommendations. So email simple. So we just try to then follow up and say, hey, just as we discussed today, this is what we agreed would happen. That way, if 2 months or 3 months from now, another staff goes in there and there's a disagreement, we can go to that documentation and say, hey, this is what we discussed. This is correct or not correct, and we can go from there. So that's, how we're trying to address those moving forward. So that's really just a quick overview of what we're doing every day in food protection, but I would be happy to answer any questions that anyone has. Yes.
I'm curious about, I had like 3 things that I noted.
Sure.
You mentioned that shadowing was done for existing staff?
Shadowing is done with new staff primarily with existing staff. So
I
they're
see.
just going out to see how things go, to see how the process works.
Okay, I misread that.
Okay, sorry. I speak quickly,
I thought
so-
it was up there with existing, and I wondered why you would be doing that.
Sure.
Okay, and then the other thing, with the current administrative cuts to the FDA, has that affected your department at all?
So not so far directly. We still have a liaison at the FDA that we can contact. She is still there and she is still available. So there was just, when the administration changed, there was just a small period of time there where they really were not allowed to interact with, local health departments and stuff, but we're through that. And so it hasn't impacted us directly, no.
Okay, and then one final question. You didn't talk about fines.
About fines?
Any kind of fining?
Oh,
or-
sure, sorry about that, that's a really good question. So, in most of the food situations that we have in the inspections, we go out and do a reinspection, it's corrected, we move on. So we have a couple things in place, and really, for fines, that's really only issued in our situation if we go to court for that. And those are really rather, it's a small number, of course, but we do have some. We've had some repetitive mobile food operations operating without permits. They've been told, we go out, they're doing it again, when they've been told, so we have gone to court on those. So fines can be issued in that process, anywhere from $100 to $1,000 for each situation. And then we do have a reinspection fee, so it's not our intention to go back 6 times for the same violation. So to encourage them to do that, we will go out for the first reinspection at no charge, but if we have to continue to go for the same one, it's $95 for each reinspection. So that's kind of really just a recouping the cost, not really a fine.
Okay, okay, thank you.
Oh,
Thank
sure.
you for the presentation. It
Oh.
was very interesting.
Okay, thank you. Yes,
I
sir.
have a question.
Sure.
The slide that showed the inspections are done under the, it was 2022 Retail Food Code,
Yeah.
Public Health 705 Code, and then the County Health Code.
Yeah.
Obviously, the County Health Code is county, Public Health 750 is state.
That's the Illinois Department of Public Health.
Okay.
Right, and then the FDA Retail Food Code is the federal guidance document, and that's been adopted by almost all of the states as really the guidance document for food protection at the retail level.
Okay. So as you kind of go through those hierarchy of documents, I'm going to ask a real broad question.
Sure.
I don't expect
I'll do
you
my
to
best.
answer, but if you do, I'll be impressed. So let's just start with the 2022 Retail Food Code. Like, how big of a document is that?
It's so funny, I almost brought it with me. I should have. So it's a bound document, it's probably this thick.
Okay.
You know what I mean?
Yeah.
And it's not like it's fine print in there, it's sections and charts and things like that. But what's nice about it is there's also an annex that's twice as big that goes with that just provides information about all those topics in there.
Okay.
Mhm.
And then how thick is the 750 code?
It's probably about 10 pages anymore.
Okay.
Yeah. Mhm.
And then the County Health Code?
That's probably also about 10 pages.
So really, the Retail Food Code is the Bible,
It
and
is.
then
Yes.
maybe the other two are kind of supplementary.
They are. So the 750 code for the state really deals mostly with the food manager certification that's required because that is a state requirement. And then our local code really involves mostly, there's some clarifications, but it's mostly administrative. So needing a permit, how we issue the permits, when the permits are due, that's the majority of it.
So that the 2022 Retail Food Code is maintained by the FDA. Are the
Yes.
standards in there based on legislation that was passed in Washington, or?
Oh, that's really a great question. So now you'll get to see me get excited about food. So there's a conference of food protection. So really that is the national experts in food that get together every other year and review all of these requirements in the food code. And then people like me, like states, are allowed to then make suggestions, like this should be incorporated into the FDA Retail Food Code. So these are really the experts across the country that review it, and then they have a whole conference on it, they make recommendations, some things get into the code, some do not, and then some come up, at a future date. So really, it is, done I would say administratively, you know, and the FDA Retail Food Code is not regulatory specifically, it's a guidance document, and then we adopt it as regulation.
Okay. So the Conference on Food Protection, how many people are in that and who decides who they are?
Yeah, that's a good question. I'm not on it, but I would say that I'm not sure of that, but I will get that for you. I could certainly get that for you. It's a fairly large number of individuals, and I mean, they do have, you know, specific backgrounds in food protection, food science particularly. The thing about the FDA Retail Food Code is it is a science-based document. So the nice thing about it is you can do almost anything in a food establishment, provided you can put the controls in place so that you don't have a foodborne illness, right? So if you can put those controls in place. So I will get that information for you.
I appreciate that.
Absolutely.
And then you mentioned the inspections are electronic, they're available online immediately. Is there any, is the way it's listed, and I guess I can go look later and probably get the answer, but I'll ask you anyway.
Sure.
So is every single establishment that's in the county listed, and then it breaks down into when the last time they were inspected type of thing, so?
Right, so it is by every establishment, and you can look it up by the name or the address. Most people are I'm just gonna say McDonald's, so you put in McDonald's, you know, and then all the McDonald's will come up, and then you'll locate which one. And it will have the inspections that we have in the system, so it's not limited to the last inspection.
Okay. And I know in the presentation you highlighted the category 3, 2, and 1. Within those different categories, is there any methodology that's used to randomize and make sure that, not that often, but from restaurateurs, they feel like they're being picked on, they get inspected more often than others?
Well, the inspection frequency is determined by the risk classification. So I'll just kind of tell you how it falls out. So a risk category 3 is really mostly retail, very limited risk, bars that serve only drinks, that type of thing. That's category 3. Category 2 would be food for immediate service, fast food type places, our McDonald's, Burger Kings, all those type of operations. And then our category 1s are ones that have complex food handling, and then, or they have a vulnerable population that would be particularly susceptible to foodborne illness. So our breakout on those is, we have about 775 that are category 1, so the far majority are category 1. We have 400, about 75 that are category 2, and the rest would be category 3. That's under 300, I believe. And we do have to reassess those every single year. So our staff, during one of their inspections, they have to complete a risk assessment and say, are they the same? So we do have some that go up or some that go down, more complicated. They decide they don't want to do that, they're less complicated. So then we just change the risk classification, you know, through the year as appropriate.
Okay.
Like long-term care facilities would be in that category 1.
That may be category 1, correct.
Okay. I think that's all I have.
Oh, okay.
Thank you.
Oh, well, thank you. I appreciate it.
I've had, in your presentation, you
Sure.
had mentioned the webinars that you started last year. I
Yeah.
was able to sit in on a
Did you sit
couple
in?
of those.
Okay.
But there were a couple that I missed. Are those available yet online?
You know what, I will speak to Christine about that. We have talked about doing that. So she does a PowerPoint presentation for that. I'll make sure that they are. I'll talk to
Okay.
her today, and certainly we can put those up there. I think we talked about it, and they should be there, but I'm not sure.
Okay,
I'll make sure.
great. And I know, I've had inspections, and I know that when inspectors show up at, you know, a restaurant or an event or whatever, you know, people tend to get a little uptight. So I know that, you know, the inspectors often have, you know, they don't know what to expect. And our inspectors do certainly have a lot of training. Are we, I guess, taking steps to kind of ensure that the inspectors are approaching vendors and operators with more of like a collaborative educational tone, like rather than a punitive one.
Yeah, I mean, our focus is to be collaborative, there's no doubt about it. That would be what we want that approach to be all the time. You know, I'm not in the field with them, you know, Christine goes out and does that, so that is one of the things that we review during these exercises, that's what we want it to be. And so what I do here though would be all the times we're talking to people on the phone, right? So every time we have a temporary food event application come in, we actually make a phone call to those people, the vendor, so that actually that's when that happens. We have a whole checklist to go through. So our hope is that it's going to be, you know, a smooth situation. You know, on the other side of it, I would say that we have unfortunately had to go to some teamed inspections with some of our food operators because we have, from the staff point of view, reached a point where there are some situations where they don't feel comfortable.
Right.
And so it's an unfortunate thing. So definitely that's our focus. I mean, do you think from your experience, you mean that we need to do more in that regard?
Not my personal experience, but I know that, you know, whenever anybody from the government shows up, you know.
Sure. Yeah.
People tend to kind of get their guards up because
Sure.
they're afraid of, you know, any type of.
Sure.
So I was just hoping to
Exactly. Now
to hear that was kind of incorporated in the training on a regular basis, just
Sure.
to, and I know from my personal experience, I mean, I've had good relations with the health department for many years, so.
Sure. But you bring up a good point, because when we go into a food establishment, we're there to tell you what you're doing wrong. You know, so that really does set a tone at the beginning. But I would tell you that we do try to focus on things that are done correctly. And we've tried to do some additional things while we're in the inspection to alleviate a little bit what you're saying. So for instance, we don't want to go out there and do the same inspection. If someone can't get something done, we don't want to show up 10 days later because we know it's not done, right? And we don't want people to be paying $95 because it's really we're just trying to reduce the cost and be effective and efficient. So what we've done is we actually now give them a piece of paper about how they can apply for an extension of time, you know, so they can avoid those types of fees and things like that. So we try to, you know, continue to build things in like that to make it easier for them. One thing we do see sometimes is that, you know, there's a disconnect, particularly in larger operations, you know, with the person we're talking to, and then it gets up the chain properly too. No, so we try to be cognizant of that. We will do that. We'll continue to work on that. We do want it to be a collaborative experience. There's no doubt about it.
So when you guys have to do like a reinspection, there is like a time frame that you guys have to.
Yes, so depending on the violation, it might be 24 hours, it might be 3 days, it might be 10 days. So that's written right on the report. If they, let's say they had a problem at a sink and they have to do a plumbing repair, and we say we're going to be back in 10 days. First thing we do is make sure that they have an alternative so they can handle the food safely. Once we've gotten past that point, let's say they can't get their plumber out there, they're behind, they're not going to be there for a week. They will send an email to us, we have a process to review them, and then we can extend that period of time so that, you know, we're not just running back and forth and they're frustrated. So we do try to make improvements like that, you know what I mean? Because we don't want to be out there when we don't have to be, we just want to see us corrected, and we want to move forward.
So when there is a reinspection, does the same inspector go out? So
Almost
they're
always.
more familiar with?
Yes, almost always, but if someone's going to be off that day, we do have to meet those, that's one of the things we're reviewed on, is do we meet our reinspection targets? And so it can be assigned to another. But they are working off a specific report, and let's say they had 8 violations, 2 of those might require reinspection, and that's what they're there for,
Okay.
right? So we don't usually see too many problems with that.
Okay.
Mhm.
Okay. Yeah. Great. Did I hit any other questions? Does anybody else have any other questions? No? Great.
Well, thank you so much. I appreciate the opportunity.
I really appreciate you coming in because I know enough to be dangerous. So it's nice to, get that refresher and the webinars, I just want to say that I think they're very helpful and
Oh,
I
that's
think
great.
it's a good idea to maybe redo those, have those available online and,
Yes.
maybe add a few others. 'Cause
Absolutely.
I know sometimes it's, as an operator, it can be a little intimidating for people to, call in and ask these questions.
Sure.
So,
No, I appreciate that. We'll keep that in mind. We want it to be collaborative for sure.
yeah.
All right, thank you so much.
I definitely get that from you, so I appreciate that too.
Oh, thank you.
Well,
Thanks so much.
Thanks again, Pat. Okay, next up, under reports, have a mental health board update. I saw Connie
Yeah.
here. Connie, would you like to join us?
I'm gonna sit here, I'm deaf in one ear, so I wanna be able to hear all of you. I don't usually tell people my disability, but I'll tell you today. A lot is happening at the mental health board. We're looking for an executive director. And also our director of compliance resigned her position as of June 6th. She has a better offer to run an agency. It has nothing to do with looking for an executive director. I want to make that clear. She did a great job, and I hate to see her go, but we do have another position. So at the board meeting on Tuesday night, we appointed Bridget, the administrative assistant, the acting director, not executive director. So you'd have a point person, and the agencies would have a point person to contact instead of who do I contact? And I've been spending probably about 8 to 12 hours a week at the mental health board, getting everything all set and doing things. We're working through HR here, and we have some applications, I should say, for executive director. It is open until the end of June, that position. We have to post the director of compliance and strategic planning. I have to look at that job description and make sure it's up to date before I post it. But it will be posted through HR. So that has happened. But I have to tell you, I am so proud of working with the county board and Peter and everyone, Scott. They've been so helpful in offering everything, and I'm so appreciative, I really am. But I'm gonna give you a little bit, I know Peter was gonna talk about that, but I'm gonna talk about something that just happened Tuesday night. It's fresh off the press. We approved our budget for FY '26. The budget was approved at, let me just put it up, $12,761,000. Of that money, $10,856 is going directly to client services. So the majority, of course, is going to client services, as it should. With the rest is, we run a building, we have to take care of the building and all the other stuff and administrative. So that's our budget. On the 12 million, and I'll just round it off, 1.9 million is coming from our fund balance. We have a fund balance that we can dip into for only so long. But to make up that, and we funded people, when I say flat funding is what they got the year before, no increase. And so we can't fund new programs that come to us unless we unfund something else. So at the present time, we decided mid-year to give increases for money that came back to us. And what I mean by came back to us, if we gave, and I'm making this as an example, $1,000 to an agency and they haven't used it, it comes back to the mental health board. And we want to give that out mid-year. We have over $1 million request for the mid-year, and we have about 400,000. So it will be a tough decision, but it's money that will go back to the agencies and what we can do with it. Trying to think of everything that I could tell you new that's happened. That's the budget. We fund balance probably we can dip into it until probably about 2027 at a flat budget. I want to make sure that people realize that a flat budget, that's what we funded before. So it's hard to, when the agencies come in and want more money, we just don't have it. But I know the agencies will probably kill me for saying this, but we always have more requests than you have money for, always. So I wish we had money to fund everything, but we don't. But that's pretty much the update. Let's see if I forgot anything here. I can answer any of your questions. Yeah, Karen Frist's last day is June 6th. She's the compliance. She has 2 people that work under Karen. And I'm going to meet with them next week to make sure that they can do the compliance without Karen. I mean, we gotta, compliance is our contracts say you're gonna do such and such. We go out and audit that. And if they're not doing it, then we want money back to give out. And so that's what compliance basically does in their audits. It's for our contracts. It's not a financial audit. When anyone applies to the mental health board, we ask for their audit, a copy of their financial audit. But ours is more financial for what we're funding. And we don't fund total agencies. And we fund programs. And we fund about, I'm taking this off the top of my head, so don't quote me, but about 80 programs in this county. So I think that we're missing some staff, but I'm really positive that we'll get somebody at some point in time. And it will take some time. I know some of my board thinks it should just take a little bit. You gotta, since you have the Open Meetings Act, we can only meet 2 people at once, and I have to call the whole board meeting to interview people. They all want to be involved in selecting the people to interview, so they all have to go through the stack of what we get, so it will take a while. And then we have to interview, and then our process is, after we narrow it down, say we interview 5, and we narrow it down to 2, then we ask them to do a presentation, PowerPoint presentation. We invite the agencies to come to listen to the PowerPoint talk, and then we give them note cards, the agencies, and they can leave a note of what they think, because they're going to have to work with who we hire. But the reason, one of the board members said, why do you have them do a presentation? Well, part of being the executive director of the mental health board, you better be able to do presentations. And so that's why we make them do a presentation on what they think we can do at the mental health board, what they think we can do better, what they think we do. So they have to do some research if they don't know the mental health board. So it will take some time, but I'm positive we'll get somebody that everybody, and I'm here, so I'll ask you if you have any questions, you know.
Can I just add 2 things real quick? So the director of compliance was one of the 3 positions that was recently approved for a stipend. It came through the board, just so you're aware of that. So that kind of changes that equation a little bit. And the other thing too is, as Connie mentioned, I just want to reinforce, county administration stands at the ready, willing, and able to work with MHB for any opportunity to collaborate or assist, whether it's on the interim basis or maybe even a long-term model moving forward. So there's with every transition, there's an opportunity, and we think that this is an opportunity that we're certainly willing to work with them on, so however they would like.
Yeah, and it is an opportunity to look at things, but change is hard. Change is hard for the staff. I met with them a couple weeks ago, and I said, it's business as usual. You know, just because we don't have an executive director, if you have any big issues, I'm available. Give me a call. But it's business as usual. So, and Karen Frisk found a job as head of an agency. So it's a way to move up, and I wish her the best. She's done a good job for us. So if you know of anybody, send them our way. She was the social worker, basically, that we had of our agency and did all compliance and strategic planning. So I'll open it up to any questions that you have. Go ahead.
I had a couple of questions.
Sure.
First of all, how often do you have agencies that fall into that category of non-compliance where you end up, you know, reclaiming the money?
Well, as you can see, we have about $400,000 coming back.
Okay.
they didn't use. But some of it is they asked for a position, to fill a position, and they didn't fill the position for 4 or 5 months. Well, that money has to come back to us. They don't get to keep it.
Right.
So on a whole, probably, and this is a guess, Gloria, 5 or 6 agencies have to pay back money.
Okay.
But it's just because they weren't able to hire or they didn't do, it's hard to, it's hard to predict that you're gonna do so many hours of counseling or hire a person right away. I mean, it's just hard, and it's no fault of the agencies, it's just, and that money comes back to us, and that's what she does in compliance. And
So it's usually not someone, just did something
blatantly.
egregious and, okay.
No, it's not at all.
That's good to know.
Not at all.
And then the other question was, you said in the fund balance, you have enough money to continue to fund the programs, flat funding
Flat
up
funding.
until about 2027.
Yeah.
So that doesn't leave any room to add new programs unless some of the programs that you have are dropped. Is that right?
Yeah, that is right.
Okay.
It's, we have about a $10 million fund balance.
Okay.
All right, we're giving out 1.9 to say $2 million for this year's budget that we're in. And if we do next year's budget at the same thing, we're gonna have to give out $2 million more. So I'm just saying, at some point in time, that fund balance is gonna go away. And then we will have to cut some programs. There's no way we can't, how are we gonna come up with $2 million? We do have it now, but.
Yeah, and I guess this question is more for you, Scott. Do you see anything changing with the sales tax revenue that we are receiving?
So there, I guess the one question would be if the state they're flirting with maybe an update or modernization of the sales tax, and whether or not if any additional sales tax is applied that isn't on the books now, if that would go to the special funding. So right now, the sales tax that's received for mental health board, the special sales tax, is limited on what's taxed. If they expand what is taxed overall through the state, it's unclear, but it could be possible that they'll include that expansion of sales tax onto these special revenues.
Okay, so
But I'm just saying it's possible. I'm not indicating one way or the other that any of that would happen.
okay, and you know more about this than I do. I'm just curious, did we get a definite no that there's no way to extend the sales tax to include the auto sales?
That would require a legislative change.
Okay,
And my understanding is that that's not gone anywhere
okay, but that could happen.
with a legislative change.
Optimistically, that could happen.
That would be
Okay.
great if.
Okay, so we're into optimism, so if
Well,
that happens.
I'm an optimist, so.
Okay, thank you.
Do we have any preliminary sales tax numbers for the beginning of the year? Because I had read somewhere that
I think we do
It was-
somewhere, but I don't have it with me.
Yeah, it comes out, every month it comes out, and I think it's 3 months in arrears, but when they collect it, and then they assess it. We've been tracking that. I don't have that with me, but since its inception, we have that data, and I think it goes up through I think the February receipts that are reported. Because like I said, there's always a delay of 2 to 3 months when you see it. So we're tracking it, and I can't report on exactly how we're tracking this. But
I'm optimistic.
I know, yeah, I think, well,
If we add the vehicle tax, believe me, that would be great.
Yeah.
And the grocery, I panicked when I heard Pritzker go, the state's not gonna add tax for groceries anymore. But then, the towns are all adding tax, but that doesn't come to us.
doesn't,
And all of a sudden I thought, oh my God, we're gonna lose grocery tax now? But it wasn't part of ours. I had to go back and research it myself,
Yeah, okay.
so.
And just one more question, Scott, for you. Wouldn't it typically go up at holiday time,
yes.
I mean, I know some crazy things are happening now with administrative cuts and tariffs and that kind of thing, but people are still gonna buy a lot of gifts at Christmas and, Thanksgiving and those times of vacation time wouldn't we typically get more
Yes.
revenue from sales tax during that quarter?
Exactly. Every month is different, and there's always a spike around holiday time. Of course, it's typically followed by a drop in January, February spending because of the
Yeah, I'm
holiday
thinking of
fatigue
Black
and
Friday
headache
here
and
now.
hangovers. So, but it fluctuates month to month with us, which is why it's kind of challenging to predict what it's going to be over the year. We know where the trends are, we know where the high points are, but what they're exactly going to be, that's, obviously, until you see the data, you actually know. And a lot, it has to do with the state of the economy. If as prices go up, of course, then taxes based on the price, and, of course, the tax will summarily go up as well.
Okay. All right, thank you.
You mentioned you fund programs, not agencies. Is there and all the requests, whether it's you're always going to have an excess of requests.
I'm not here.
You're always going to have an excess of requests for programs, and that's because that's essentially if someone has a nonprofit that provides some sort of mental health services, substance abuse, developmentally disabled, they can come forward with a program to propose.
Right.
So as you're looking at agencies that come forward, whether they're new or existing, agencies that you're funding existing programs, is there any sort of percentage requirement? Let's say I have an agency and our annual revenue and expenditure is $1,000, but we want to launch a new program that's going to cost $10,000. Is there any barometer or measure that you guys use to determine whether or not you're going to give that $10,000? And also, if you were to allocate that $10,000 to them in year one, is there an expectation going forward that they develop alternative revenue streams to make that sustainable beyond the mental health board?
Yeah, well, we always hope that they look at, fundraising and other revenues to come in. And we hired, last year, we hired a grant writer out of Washington, D.C.
Okay.
And he has to, for his contract with us, apply for, and grants are hard, apply for 4 to 6 grants a month. And last year, we were able to give out over $1 million, and one was to the court services, that our grant writer wrote the grant. And I made a decision and brought it to the board just this last month. I said, why can't we write a grant for the mental health board and have all these agencies back it so they get this money, that it would show up more. I mean, we would get more money, I believe. And the old executive director did not believe in having any money come to the mental health board and then disperse it out. So that's another way of getting grants, is say, here's this agency that funds all this stuff and this money's gonna go here. It just makes your grant a little bit stronger. So yes, we do ask them, and if they came in, we look at their applications first. The applications come in, we look at them in August, September, and October is when we decide what we're going to give out in our budget for the next year, for December 1. So if they're asking for something unrealistic, I mean, we know that. For example, we had a town hall meeting, and I had a hip replacement a month ago, so I was not able to go to the town hall, but I was on Zoom. And a lady said, why don't we have more Scylla homes? Why don't you just go out and buy a home? And I said, well, first of all, I don't have the money to buy it. I'm thinking this because I'm on Zoom. We don't have the money to just buy a home. And there's more into buying a home, a Scylla home. First, you got to have the fire marshal look at it. You got to hire the staff. You got to train the staff. You got to furnish the. There's a lot of stuff than just buying a home and putting people in it. And so that's needed here, but we have to look at state funding that is going to fund that home too. So it's not just the mental health board.
Right.
So, but we do look at all, like the applications that just came in here, prior to this last year. The mental health board looked at whenever they needed money in agency for something that we funded, they could come in and ask, write a letter and come in and ask. Now this board has decided to do it once a year, and this is the time they're doing it. And like I said, we have approximately $400,000 to give out, and we have $1 million worth of requests. looking at the requests, I could say to myself, I'm one person on the board, these are what I would fund. I really think they're needed. These other are okay, but my priority would be this, after looking at what people in the community want. And we tend to forget, I think, the developmentally disabled, or they don't have much. And I have a man that I'm working with who's 93 years old, his son is 60. He's developmentally disabled, doesn't have a wife, doesn't have kids, and says, what's gonna happen to my son when I die? Connie, tell me what's gonna happen. And I said, I can't, but I tell you what I would do if I were you. I would find a agency, donate my home with the understanding my son could live there and what he's used to, and tell him to get money to run it, as a sell a home, because it's a big purchase. So he's now meeting with one of the agencies that might take a donation of his home. But I mean, it's hard. It really is. If you have somebody who has developmental disability, there's waiting lists.
As you look at the $10 million pie of funding
That people want this time halfway through?
Yeah, and is there an allocation formula that says X percentage is going to go towards developmentally disabled, X percentage is going towards substance abuse, and X percentage is going towards mental health?
No, we don't have that. We look at what's come in. And one of the big needs is a warrant of need. And a warrant of need is like the young man I'm telling you about. And we give warrant of needs to agencies. And then they decide on their waiting list. We don't decide who comes in. But there's two agencies, which is Pioneer and Clearbrook, that have a big, big waiting list. And they came in with, I know this, with one of the requests was some warrant of need to find more people to go into their facilities. So we don't have a percentage, we just look at what's come in. But I can tell you, some have come in for substance abuse, some for mental health, and some for DD. So they're a wide gamut. But one of the agencies, I can't remember, we have 400,000, was asking for like eight or 900,000. It's like, come on, guys, it only goes so far.
So let me just clarify my understanding. So the disbursement of the funds and the allocation of the funds is based on needs expressed by or articulated by providers?
Providers fill out, mid-year they just send in a letter and what they request and all that. But for the full year, they fill out a total application, and their audits, everything's in there, what they want, how many people they're gonna serve, if it's a warrant of need, whatever it is, purchase of physician. They fill out a really big application, and that's what we do the compliance audits, to make sure they're doing what they said they're doing, because we're giving out the money.
But I'm more looking at it from
How much are we giving out to substance abuse?
yeah, like what's the need in the community? Because I didn't attend the town hall this year, but I did, I think, back in 2023. It was a town hall or an open house, and there seemed to be a lot of need for the developmentally disabled, and specifically situations you're speaking of, where you have aging parents with younger children who...
There is. I mean, one of the things years ago, it's called McHenry County Adult Programming, and they couldn't find anywhere for their children to go because they were more severely and profound. And these parents started their own program, and they fund their own program. They don't get any money from us, but they are in our building. And I just feel for them so much, because they bring their kids in, you watch them unload their kids, you watch them pick up their children, because there was nothing in this county. They were turned away from everything because they were so involved. And so the parents said, we got to do something. And they started their own program. So it's hard. If you've got somebody who's DD, it's hard. And, mental health is another one that's hard, and, substance abuse. When the dollars dry up of the opiate funded dollars, I don't know, when do you think that's going to dry up?
That I don't know.
Okay. Because we fund it with the dollars that come in from big pharma and stuff like that. So when that dries up, that'll be a big need too. So, yeah, I mean, it's tough to make the decisions, it really is. And especially, I can tell you, being in this field for a long time, we fund a day program at Pioneer Center for DD, and we funded it since it began. It's a good program. We're gonna probably continue to fund it. That's a program that we'll continue to fund and have always funded. So, because where would they go if they didn't have a day program? So, yeah, but I don't know, there probably is a percentage, Mike, but I don't know the percentage. We just look at what comes in and what the needs are. But I could break it down and get a percentage, how much goes here, but I don't have it with me.
Thank you.
Any other questions?
Thank you for calling the 60-year-old a young man.
Yeah, you know, the older I get, I want to believe that 60 is young.
Yes, I do too. And best of luck on
Thank you,
getting the lead.
thank you. Okay,
Thank you for
I just
Right.
want to mention one more thing. You mentioned something that was very interesting. I know that Clearbrook has some solo homes here.
yeah, we help fund a couple.
Yeah, and I was going to ask you that question, and you mentioned it because, I was at Riverside Foundation for 16 years, and before I left there, we had developed a plan for adding more solo homes. I think we had 4 when I left. So my plan was to, because we were getting more and more people that were medically complex. So DD with medical complexities is, it's very hard to place someone who's profile. So the plan was to increase to 10 solo homes and reduce the population at the residential facility to something like 70 as opposed to 100 clients. And they are following through with that plan. But Clearbrook has been a leader in Lake County with the solo homes. So I was really surprised that, when they first moved out to
We asked them to come out here.
Yeah, did you? Okay.
Yes, we went in there and talked to them. At the time, Carl Lamel was the executive director. We asked them to bring their services out here. And they have a day program services, and they have solo homes. And their latest solo home, because I toured them, it's right down Raffle, right off of Raffle Road in that the first subdivision. I don't know what it is. But, I mean, they have beautiful homes. And
They do an
wonderful.
excellent job, and before Riverside went into it, we met with them. They were very collaborative, was sharing with us and had workshops with us and told us, how they did it, and so they have a really good system going.
They do, and they do some of the same things that Pioneer does, but they're growing in their solo homes, but it does take a while to get up a home.
Well, and the thing is that is the trend because the residential care is being phased out by the state.
Right.
Not just in Illinois, but throughout the country, because it's a lot of money.
It's a lot of money.
And the clients don't get the care that they need. So when you get 6 to, maybe 8 people in a solo home, you're going to get better care. You're going to get you cut down your overhead quite a bit. So you go from IDPH to DHS and DPH. So you're dealing with, maybe a couple of different new agencies now, but it really is a trend. So we're going to see less and less of the residential facilities as time goes by.
Yeah.
So
I agree.
I'm happy to see them pop up, and I'm glad that, we are able to fund them through the mental health board.
And people ask all the time, why are they so small? Well, I can tell you that because I established a lot of solo homes myself. Woodstock has a law, or it's on their books, 5 unrelated people can live in a house.
Right, exactly.
You can put 8 in a house if it's county zoned. And you don't want to buy a house that your neighbors are going to complain. I remember one of them complaining about one of the solo homes that they were all downs in this home and that they were gonna rape their neighbors and hurt, I mean, it was just unheard of, but it's hard. So you wanna place those homes where you're not gonna have that much objection. And if you can place it right on the edge of a town in the county, you can put 8 people there. But most towns, and I know Woodstock is 5 unrelated people. So you gotta look at zoning too, so if you broke a zoning law, they'll really, after you spend all that money trying to establish a home, they don't want it to go, so.
Yeah, you have to go before the county for all of
Right.
that. And different cities like Gurnee and Grace Lake. Grace Lake has one that's a little more liberal with how many unrelated people can be in a home. But depending on where you go,
Yeah, it's
it
hard.
changes. So you have to know that, right? Thank
Well,
you.
you know it then, yeah.
Well,
So,
Thank you so
You're
much,
welcome.
Connie, for
anytime you have any
coming in
questions
for-
or you wanna stop by, I know you stopped by and we talked for a long time, so. And I know Mike came by a few years ago, so. And Gloria, we've known you forever. I'm inviting Patrick to.
It's been a while.
Okay, thank you so much. And thank the county for helping out. I mean, really and truly. We're using your HR department and using Peter to look at different things, so.
The mental health board is lucky to have you taking the lead on a lot of that.
Thank you, everybody.
Yeah.
Appreciate that. Thank you. Okay, so that's it for reports. Future topics. I know we have a few things lined up. Is there anything anybody has any special interest in? No? Okay, so seeing no executive session, is there a motion to adjourn? Ms.
motion.
Van Hoff and Mr. Shorten seconds. All those in favor?
Aye.
Thank you, everybody.